Well, we're back, and I have another question. How do families deal with dementia in their group? Let's pick on mom or dad,
Okay.
because grandparents are usually off to a side, but with mom or dad, how do you deal with it when you see a tremendous change in the way your parents act?
Well, the first thing to do is not to tease them about it. You know,
Never.
To make humor is a good thing, but when it's appropriate. The other thing to do is if you see a tremendous change, an immediate onset of a change with your mom or dad, the first thing you want to do is get them to the right professional to find out what's going on, because there could be all kinds of different things going on.
Well, is this a case where you take them to their family physician to see how they are physically first,
Mm-hmm. There are
and then go to the next?
Then go to the next level. There are, it's basically what you want to do is look at getting a medical evaluation, a total workup. And this is something that you can talk to your physician about doing. That workup would include an examination, maybe some testing, some more severe testing, and that sort of a thing. The only way to actually diagnose Alzheimer's or a true dementia form is at the point of death, unfortunately, and with an autopsy. But in the meantime, if you're noticing changes, get the person to the doctor, let the doctor do his or her immediate testings and things of that nature, and then refer you out to the more appropriate specialist. There are dementia clinics around the area. There are assessments that can be done thoroughly. That would include blood work, like I said before, scans, x-rays, and that sort of a thing that will help.
Jean, I think it's important to point out to the viewers that sometimes changes come on very abruptly.
Mm-hmm.
Usually abrupt changes in the level of consciousness indicate that something is going on that needs immediate attention.
Right.
When you have changes that occur over a long period of time, you could take your time to get to your family doctor. When you have acute changes, you need to take your loved one to the emergency room. Infection, strokes, or limiting in blood supply in the brain can all mimic certain signs and symptoms of dementia, and if you get there quickly enough, that process can be reversed.
Well, if you listen to television, you hear about all kinds of pills for this, that, and the other thing.
Well, we're going to tell you to be very careful about the pills.
Good.
Just taking a pill is not a good idea. There are many, many good medications out in the market that have helped our nation tremendously, but some of those medications also have very severe side effects, especially those that sometimes are prescribed to help treat the dementia process. There's a group of drugs called antipsychotics that sometimes people will get put on because they have certain behaviors, or mom or dad aren't just the way they used to be, and we want to fix mom and dad. But making that decision without a thorough diagnosis and thoroughly being informed about what the risks and benefits are really needs to be done before you make that decision.
In fact, that's actually dangerous.
It is. They can be very dangerous. So while we want you to trust your medical professional, we also want you to be an educated consumer and ask questions. If you don't understand what's being prescribed or why, don't take it. Consult your pharmacist, ask your physician, get a second opinion.
Well, because mom and dad are kind of precious, you only get one
Yes.
set of them, really.
Correct. Mom and dad are probably of that age where they really are very respectful of whatever the doctor says. I now know my own father will do exactly what the doctor tells him, and he doesn't ask questions. And sometimes it's not beneficial for him.
Well, I understand. More people do not ask questions than do. And I think sometimes it's because they're afraid of what they might hear.
You're very correct. Jean can address that. She deals with that every day.
Okay, Jean, we're back at you.
Well, actually, the best thing to do, I think, would be to become educated. You know, there's a lot of resources out there, like Deb said, your pharmacist, sometimes your physician. But now that we have the World Wide Web, you know, that's also a wonderful resource too. But again, you want to take everything in moderation.
Well, there is that old adage, everything in moderation.
Everything in
And they
moderation.
mean everything.
Everything. But sometimes when the older person is doing that in moderation, what will happen is when they first find out or internally feel that something isn't right, then they will try to compensate for it and try to hide it from
Cover up.
the cover up. They will try to cover up what's going on because they don't want that label of having dementia on them, or letting their sons and daughters and all the extended family know that something is not right with them. So what I've heard a lot of the older folks may try to do is leave little notes around the house for themselves, but then try to remember, that's a problem too, is to go back and pick up all those little notes before the kids come over for a visit. And covering is a lot of the people that are experiencing initial cognitive problems or memory loss are very, very good at covering up.
Well, I never thought of it that way, but I believe you're very, very good. Just in thinking of the older people in my family over the years.
Mm-hmm.
And yes, they don't want to admit that they may have forgotten something. They don't want to admit something is wrong with them either.
Right.
They also don't want to lose their independence. That's very,
That's
very
the biggest
scary.
word in the elders'
And I can give you a
library.
good example of that in my own family. My mother-in-law was very dependent. She's 82, and she drove all over town, and we thought Mom was great. She would sometimes repeat a lot of questions when we were together, and we thought that was just her personality. It was what she did. That was Mom. Well, Mom went in to have a little minor procedure and needed to go to do some rehab at one of the facilities, and my husband got a call and said, "Do you know that your mom is forgetting where she's going? Do you know that she got lost? She told me she couldn't remember where she was going down the street." So that triggered us to have a thorough examination. Mom never got her driver's license back. And to this day, it's been a year and a half, she's doing very well, but the thing that she hates most is that we took her driver's license. The doctor took the license based on the outcome. But, you know, even as a nurse, I missed that sign in my family member.
But yes, I have seen this in my extended family as people got older. They don't want their driver's license taken away because that is their independence. And you end up like telling Mama or Papa it's the doctor's fault because he's the one who is taking it away from you. So you have to feel sorry for the doctors.
They have a tough job. Yes.
You know, they get yelled at an awful lot. But yes, if they hit a point where they're really forgetting, and many a times it's not just the brain, but there's a tremendous physical change in them, and if you check them through, you'll find there's a major change.
There were actually warning signals, and we can talk about those after we take a break.
So let's take the break and then we'll come back.